Tonight, people all over the country are talking about Angelina Jolie's revelation that she had both of her breasts removed in a double mastectomy. Jolie decided to have the radical procedure after learning that she carries a gene that makes it likely she would one day get breast cancer. Her mother died of breast cancer at 56 years old, and that motivated her to have the test for the BRCA gene. Well, Jolie is the latest in a number of public figures to have the test done and undergo a preventive double mastectomy. But Fox 26's Nancy Zambrano is here to tell us why it's not that easy for just anyone to have the test done. Nancy.
And Melinda, the numbers are pretty scary. 1 in 6 Houston women are diagnosed with breast cancer each year. Now, there is again a test that will test your chances of getting it through genetic testing, but as we learned today, it doesn't come cheap.
Angelina Jolie and Sharon Osbourne have both made their decision to undergo a double mastectomy public. You may also remember earlier this year, Miss Washington, D.C. announced she too carried a genetic mutation that increases her chances of getting breast cancer. But you don't have to go too far to find women just like them.
It's a life or death decision. It's not something you ponder over too much.
Nancy Jacobs had her first stint with breast cancer at age 32. She underwent radiation and later was advised to take the BRCA test. The test checks for mutations in 2 genes, BRCA1 and 2. Since Jacobs already had breast cancer, the test indicated the chances of a reoccurrence. A high score for her meant undergoing a double mastectomy.
Our breasts as women are how we look at ourselves. It's our femininity. It's who we are in a way. I can remember looking in the mirror the night before it was going to happen and crying.
But looking back now, Jacobs says she wishes she could have taken the test sooner and made the decision to remove her breasts earlier.
In my case, I went for the less drastic procedure when I was young. I wanted to retain my breast.
There is currently no standard criteria for referring anyone for genetic testing, but it's recommended women with a family history of breast and ovarian cancer also take it. The test, however, costs about $3,000.
In speaking with my gynecology colleagues, they have great difficulty grappling with some of the third-party insurance carriers to get the test covered.
Dr. Franklin Rose has performed hundreds, if not thousands, of reconstructive surgeries on double mastectomy patients. He's helping Jacobs with her reconstructive process, one he says that can have a tremendous effect on how women feel about their bodies post-op.
As it would relate to sort of psychological impacts of reconstructive surgery, just body image and self-esteem are so much improved.
Jacobs applauds Jolie's decision to tell her story, but she hopes in the near future genetic testing of this kind is more accessible to all women.
And fortunately, more research is being done to find newer, better, and hopefully less expensive ways of detecting these kinds of mutations.
And Nancy, that would be great because any woman who's concerned hopefully one day will be able to just take a test and know what her chances are.
That's right.
Thank you so much.
Knowledge is power.
That's right. Don.